Hi everyone. We're just waiting for a few extra people to join, so thank you so much for joining us. Welcome to the laser eye surgery webinar with Dr. Adam Watson and Dr. Nick Mantell. I am Jessica Arcoy. I'm going to be here to take all your questions and pass them on to the doctors. So it looks like we've got about just over half the people here. So I'll pass it over to Adam and Nick to introduce themselves.
Yeah, hi, Adam Watson. I'm, as Jess was saying, one of the laser vision correction surgeons at Eye Institute. Been there about 14 years now, and I also have a cornea subspecialty in oculoplastics as well as cataract surgery.
Yeah, g'day. I'm Nick Mantell. I'm one of the laser surgeons also. I've been here for too long to remember.
Yeah.
But we're looking forward to talking to you and answering some questions. So, Jess, how are we going?
Great. So, yeah, it looks like we've got the majority of people here. Why don't, Adam, we start off with the video or the slides, and then we can get straight into questions. Please add your questions at the bottom, just in the Q&A tab, write your question in there. We've got a few questions that people have sent in, which we'll look to answer first, and then we can go into those other ones. So feel free to... We're
going to see how this video goes, and if it's not playing so well, we might shorten it, but we'll talk you through it.
Great.
Yeah, so just by way of introduction to Eye Institute and to the process of laser vision correction, there's a short kind of casual walkthrough video of our laser suite. You'll see the virtual background behind me, in fact, appears in the video because that's where you first arrive if you are going to have laser. And I'll just bring up my screen and we'll play that video for you.
This is our laser vision correction lounge, and I'm Adam Watson. I'm one of Eye Institute's laser surgeons. I'm going to take you on a little walkthrough through our laser suite, so it'll give you a bit of a feeling for exactly what your experience will be when you come and see us. Let's go. So when you come in, you'll be met here by one of Eye Institute's laser nurses, and she or he will take you through this way. And this is like a preparation room where she or he will have a chat to you and do a little preparation for your eye with putting some drops in and having a chat to you about what you're going to experience in a couple of minutes. Here you can be with your partner or caregiver, and then we bring you through this way. And this is the actual laser room. This is where it all happens. Come on around and we'll take a look at some lasers. So number one, we have our Zeiss VisuMax femtosecond laser. This is the latest version of the Zeiss VisuMax, and we use it for smile laser and also for creating the very fine flaps if you're having LASIK. Across here, we have the Schwind Amaris 1050 excimer laser. This is the latest technology from Schwind, and this is the laser we use to bring about vision correction if you're having LASIK or if you're having a PRK surface laser procedure. You see here we have a comfy bed in the middle. This actually moves, so if you're having LASIK, we simply use the Zeiss laser and move the bed around and do the excimer laser. If you're having a smile procedure, it's all done just with this one laser here. The whole procedure takes about 15 to 20 minutes, very comfortable. What you experience is a little unlike anything you've probably experienced before. Some people liken it to like an alien kind of experience. You see some flashing lights and some movement. You'll find it very comfortable. When we're done, we bring you through this way. Because it's time to have a rest in one of our comfy chairs. We can get you a drink, you can have a hot chocolate, coffee, you can just stay here for a while, relaxing with your eyes closed. while everything settles. You'll be in here for about 20 minutes or so. You can be in here with your partner, your caregiver, whoever's with you to take you home as well. And after 20 or so minutes, then we bring you through this way. For a final checkup. So again, you have a seat here, and this is where your laser correction surgeon will take a look at your eyes, make sure everything is looking just like it should be. At this stage, you'll find that your vision is probably a little hazy, but you can often already notice there's a change in your vision. So previously, you didn't see well in the distance, a little hazy, but you'll be able to go, wow, it's already changed for me. We put some clear plastic shields over your eyes that stay on overnight just to protect them while you're asleep. And then we allow you to go home, of course, and we see you again the following morning. So when you leave, you'll have an appointment to see us again, and see you then. Cheers now.
Okay, good stuff. So that introduces a few concepts like SMILE and LASIK, and also gives you a little bit of a feeling for the process, which we'll be able to talk a little more about later. Nick. Nick, you're on mute.
So modern technology, it's very challenging. I see we've got a question from Louise, and it's quite timely. She says, what is the difference between SMILE and LASIK, and why would you choose one over the other? This might be an opportunity to bring up that diagram, Jess, of SMILE and laser, the different laser treatments. We could just go over that. Yeah, so basically what you've got to remember about refractive surgery is that there are lots of different procedures, and today we're talking about laser, but there are other things that may be more suitable for some people. But essentially we have three different types of laser that we offer in our laser suite. First is PRK, and that's quite a simple idea. All we're doing here is treating the surface of the eye, and we don't have to create a flap or anything like that. It changes the curvature of the cornea to refocus your eye for whatever distance we want. Now the issue with PRK is very accurate as all of these treatments, but it has a longer recovery period. So the procedure you've probably heard more about is LASIK, and LASIK's a newer version of PRK. In this case, we create a very thin flap with one laser on the surface of the eye. We reflect that flap. We do the laser on the stroma of the cornea, changing the shape, and then we put the flap back down. Now, the advantage of that is you get very rapid recovery, and you're back doing things almost immediately. Now, SMILE is the latest version of refractive laser surgery. It uses the same laser that creates the flap for LASIK, but in this case, it creates a little lenticle within the cornea. And what I mean by a lenticle is it's basically in the same shape as the tissue we'd remove with LASIK, but it's in one piece. And then we're able to remove that through a 2mm incision. Now the advantage of that is that the incision is much smaller, so we tend to get less dry eye, and we can go into some of the differences a bit further. But those are the three types of laser that we're talking about. Got any comment, Adam?
Yeah, I guess I was going to say, the beauty of all of these procedures, they all offer an excellent visual outcome. So one is not necessarily better than the other, but people's eyes may be suited to one of these procedures more than another procedure. We usually reserve PRK or surface laser for people who perhaps have thin corneas, or there's some other reason why they particularly need surface or PRK laser. LASIK and SMILE, I feel, are a lot more interchangeable in terms of who would be suited for them. There are subtle differences between them, and I think that as an evidence basis goes, probably people with higher levels of short-sightedness perhaps a little more suited to SMILE, although LASIK will also give a very good outcome. On the converse of that is people with very low levels of short-sightedness are probably better to have a LASIK treatment, although SMILE can also offer an excellent visual outcome under those circumstances. And in the middle, which would be the bulk of people, really LASIK or SMILE are both very good procedures.
Yeah, Louise was particularly interested in why you choose one over the other. And I think, you know, what we're discovering is that LASIK and SMILE are very similar procedures, take about the same time, same sort of recovery period. But as we get better experience with SMILE and the technology develops, I think the range of patients who we think really benefit from SMILE is really expanding. I think the principal things that I've noticed with SMILE, if you're a suitable candidate, that I think it's probably as accurate, if not a little bit more accurate than LASIK. But the big advantage is the incision's quite small, and for this reason, dry eye really is no longer an issue. With LASIK, dry eye is a little bit of an issue. For the majority of people, not a big one, maybe a bit of extra drops for a month or two. But occasionally we get people where the dry eye goes on for longer. Now the good news is it gets better. It's just a question of how long it gets better over. And so which one would you choose? Well, what I suggest to you is that we'd probably choose it for you, but we'd obviously talk you through that. And there are definitely subtle differences between the different procedures.
Great. So I'll just jump in there. We've got a few questions that'll kick us off. So Adam, we've had a question from Lucy saying, is there an ideal age to get laser refractive surgery? Are there disadvantages to getting it done too early or too late?
Yeah, the ideal age is really right now. But to be a little more serious and a little less glib, look, we do laser for people who are aged typically about 19 to 20, really upwards. And when you're getting up to the upper zones of about 50 to 60, then you'd have to have pretty good reasons to have laser, but there may be cases where you would. But what's the ideal? Well, as you've kind of pointed out, it's when your vision is stable. And for some people, that may be when they are 20. They may have a good track record showing that they haven't needed a change in glasses or contacts for maybe 3 years, something like that. But probably for the average person, it's getting a little bit more into their 20s. You know, there isn't a perfect age, but when you're getting into 24, 25 upwards and up until probably about early 40s, those are all good ages. When you get to your mid-40s, you're running into the age-related change thing that we all get. That's that need for glasses to help with our near vision. And so while there are still very good reasons to have laser vision correction when you get into that presbyopic age group, you do have the slight downside of, in most cases, needing to have some glasses to help with your near vision once you're beyond about 45. So the sweet spot is probably mid-20s up to about mid-30s, thereabouts.
Yeah, look, from my point of view, you know, we can do laser, and it's quite remarkable. We can do laser on people in their early 20s, but we can go right through until people in their 60s and 70s. Now, in their 60s and 70s, it's really usually after cataract surgery just to fine-tune the outcome. But the point is, you know, once you have laser in a typical situation, that effect of that laser is going to last until you get other age-related conditions, most commonly cataract in your mid-60s. So the earlier you have it done, the longer you're going to get benefit from it.
Which is really why having it now is a good time, because so often people say, why didn't I do it earlier?
Yeah, no, that's a very common thing. But I think the other thing is that we're mindful of, it, and was alluding to, is in your late 40s, early 50s, you're losing your reading ability. So, you know, if you have it done when you're 40, like I did, then you're going to have great vision until you're 65 for distance. But when you get into your early 50s, you're going to start to need glasses for reading. So you're still getting lots of benefit. I'm fortunate and I can still read at 53, but it's going to happen to me eventually. So I think the bottom line is you want to be stable and you want to do it as early as you can. Now, the reality is that probably the average age for laser is probably in their mid-30s, but the people who benefit the most are those in their mid-20s.
Great. We had a question from Bella as well that came in earlier today. So she's been reading the website and there's a bit about out-of-towners. Now, how soon do you think Eye Institute will sort of reinstate that service now that we're in level 2? Do you think it'll come back soon?
Yeah, we're ready to go. I'm not aware of any particular impediments to it as long as you can travel safely, and we are able to arrange accommodation if you require that. And so at level 2, we're able to carry out laser safely. We're still practicing distancing and other barrier type of separation protocols, but we're very comfortable doing laser safely at this stage for you. And there's no reason we can't organise an out-of-town appointment for you. You're probably aware with out-of-town appointments that will typically involve some follow-up arranged with your local optometrist when you return home. And at level 2, local optometrists are up and running again.
Yeah, and there's no reason if you're out of town that you can't have laser. We do get one of our technicians to contact you, just to ensure that you're a good candidate and that you're likely to be suitable. If we need any extra information, we can ask your optometrist. But there's no reason now that the travel restrictions have been lifted that you can't come to us. You might be surprised if you're coming in at the moment. We have some extraordinary measures in place to make sure people are safe, and we take that very seriously.
Mm.
And Bella was also wondering, Nick, what would count her out for qualifying to get laser? Was there a specific list of things?
Well, look, the reality is that if you're in that age group we're talking about, there are very few people who aren't suitable for laser. Now, there are some people at the extremes who are very long-sighted or very short-sighted that may not be good for laser, but they might be good for another procedure. And we have other things like what we call intraocular contact lenses, and as you get older, refractive lens exchange. The other things that kind of limit your ability to have laser are the thickness of your cornea. So if you have an extremely thin cornea, then you may not be suitable for laser. Or if you have a condition called keratoconus, which is relatively common in New Zealand. Now, unfortunately, if you've got keratoconus, then you're not a suitable candidate for laser, although other things may be available for you. And the interesting thing is that if you've got keratoconus, your optometrist has really probably diagnosed that already. And I guess the other sort of small print is some people with very severe autoimmune diseases or very severe dry eye, then they wouldn't be suitable. But the reality is the vast majority of people are either suitable for laser or they're suitable for some other form of procedure.
Great. And Adam, we've had a question from Sarah saying, what about blended vision? So thank you, Sarah.
Yeah, blended vision is a great question. A lot of people listening probably won't be familiar with what the concept of blended vision is. We were talking earlier about what happens when you get past 45. So the lens inside each eye undergoes age-related changes that we all get, which means that we start to need reading glasses. And so if you come along, beyond about 45 years of age, or even perhaps a little earlier, blended vision can be a very useful arrangement to give you flexibility in your vision that diminishes your need for reading glasses, as well as giving you that distance vision that we all want. So whether you're long-sighted or short-sighted, what we can do is use laser to create good distance vision in your dominant eye, whichever eye that is, and leave your other eye just with a little bit of short-sightedness. In other words, a little bit of near vision ability, so that you're able to look at a computer, look at a mobile phone, do a bit of casual reading. You can nip down the cafe without your glasses and have no trouble. And it's an arrangement that works very well for a lot of people. If you are mildly short-sighted, a lot of people enjoy their near vision. They don't want to lose that near vision ability. And if you're not sure whether blended vision is going to be a good arrangement for you, then what we can do at Eye Institute is a short contact lens trial where we put a contact lens in one eye or both eyes to give you a blended vision arrangement, so you can try it out for a day or two and get a feel for what it's like.
Yeah, it's really interesting because, that's a great summary of blended vision. typically blended vision, we're talking about people in their late 40s and their 50s. And what's really interesting is that, you know, the world is changing. And so we have some other options now for people in their 50s, and it depends on the refraction. But refractive lens exchange can be, in some cases, a better option than blended vision because it's a permanent solution and it gives probably a better range of vision, particularly for near. So that sort of gets back to trying to pick the right option for you, depending on your age and refractive error.
Blended vision can be, you know, there's a little bit of a compromise. It gives you flexibility, but for some distance tasks, you might want to have good vision in both eyes if you're watching a game of rugby live or that sort of thing, driving at night. So yeah, something that works very well for some people. Prolonged reading, probably still need some reading glasses. So it's about flexibility, but there's that compromise. As Nick alludes to, we do have refractive lens exchange options for people getting into their 50s and beyond that really can deliver a great range of vision without compromise.
Great.
Yes, I just see that Seema asked a couple of questions.
Yeah, we've got lots of questions coming in.
Yeah, but it's been sitting there for a while, so I'm going to quickly answer them.
Yeah, go for it.
So, is it used only for myopics? So, no, lasers actually, we can treat people who are long-sighted or hypermetropia, and we can treat people who are short-sighted. We also, the other type of refractive error people have is astigmatism. So, a lot of people don't believe that they can have it because of astigmatism, and in actual fact, we're very good at treating astigmatism.
Very good.
That's a falsehood. And the other question was, do you need another procedure or more than one procedure? Well, look, when we do laser vision correction, it's very, very accurate. But we know that approximately 2 to 3% of people won't be perfect, in which case we do a bit of fine tuning with some more laser. Okay, it sounds pretty extraordinary, but it's usually very easy to do. No cost with that, and that means that we can pretty much guarantee the outcome. And I guess the other thing you might be pointing towards is, say you have this done in your mid-20s, what's going to happen when you get to 50, 55, and now you're just like everybody else, you can see in the distance and you can't read? Well, we can then do more laser to do some blended vision. We can look at these other options if necessary. But presumably if you have laser when you're 25 now, that's 25 years away, and I suspect that the technology is going to be very different. So look, yes, there may be other options that you need to look at when you're getting older, but essentially it's a permanent thing until you get other age-related changes.
There's a question there about what level of short-sightedness we're able to treat. So what represents extreme short-sightedness that's not suitable for laser? If everything else is good with your eyes, good corneal thickness and everything, probably we can go up to about -10 diopters, the top end of the range. Beyond that, as Nick alluded to earlier, there are other options. For instance, ICL surgery is an extremely good option for people, most people who have short-sightedness beyond that.
Yeah, we'll go back to you, Jess.
Great. That one's been
over the job.
Plenty of questions, so we'll make sure we try and get through as many as possible. So what is the average cost from Sue? Thank you, Sue. So Nick, over to you.
Yeah, well, the average cost, I mean, what we do is all the laser procedure, same cost, $6,100. And that's for both eyes, obviously includes any enhancement if you need that, and also all the follow-up visits. Now, it can get a little bit confusing because we did mention that there are some other options, for example, ICL, intraocular contact lens, and refractive lens exchange. Now, unfortunately, those are more expensive because they do involve implants and other special devices and surgery. So so for example, ICL is around about 11,500, and then a refractive lens exchange is quite a lot more expensive, in the sort of $14,000 to $15,000 mark. Remembering that refractive lens exchange is a permanent solution, which basically will last a lifetime, and it's really only suitable as you get into the late 40s, early 50s, or above that.
Great. And then one from Phoebe. So, do I need to visit the optometrist to get my eyes tested prior to booking in for a consultation?
No. It's a simple answer. We do a very thorough assessment when you come to our institute and you're interested in laser or any other form of vision correction. So there's no particular need to have a check with your optometrist beforehand. If if you do have a glasses prescription in the past or a contact lens prescription, we're often quite interested in that information because it can give a feeling for how stable your eyes have been over the last 1+ years, but it's not strictly necessary.
Yeah, I agree. Only situation where there may be some benefit in visiting your optometrist is, for example, if you're coming from out of town, and in that situation, if you're sort of got one of the more extreme types of refractive error, then it can be beneficial to go to your optician so you can get a better picture before you come. Having said that, there are very few situations where that would really make a difference as to whether you think coming to visit us would be a good idea or not. I think we sort of glossed over what's the maximum myopia we can treat. Well, it varies a lot depending on the thickness of your cornea, but we do treat people up to -11, -12 if they've got a thick cornea with laser. Once you get into those sort of high teen, like -9, -10, -11 and above, then this idea of an intraocular contact lens really comes into play because it's getting at the upper end. You may have a thin cornea or it's at the upper end of what we treat with laser, and this gives you a really fantastic option because again, it gives you very quick recovery and gives you very good quality vision. And if you're not suitable for laser, then that's a great option for people who have high myopia.
All right, Adam, we've had a question from Nick, not Nick Mantell, another one. How stable does my prescription need to be? Is this something that my optometrist would advise on my suitability for laser?
Yeah, again, oddly enough, that's not something that has an absolutely clear answer. So there are no rules about having to have a stable prescription, for instance, for the last 1 to 2 years. It's always nice to see that. But having said that, I often see people who may be 20, 21 years old, and they're going, well, look, if I have laser now, is my eyes going to change? It is possible. It's not that common. I'd say that perhaps somewhere between 5 and 10% of people who are 20 might have some change as time goes on. But again, it's kind of an opportunity cost thing. So even if you did have a change, if you're in that small percentage of people, then you can still have a little laser enhancement later on. And I guess the opportunity cost is that you wait a long time to have laser, and you miss out on the benefits for a long time while you're waiting. Whereas there's no particularly large downside in having laser earlier on, even if it did need to have a little enhancement at a later time, years down the track. Can your optometrist advise on your suitability for laser? Potentially, although they, dare I say it, are probably not the people who are best educated on how laser works and what the percentage and likelihood of various outcomes are. And so there are optometrists who are very familiar with laser, but there are others who may have other opinions that aren't strictly correct in our opinion.
Great. Another question from Dr. Louise. Depth perception post-laser, is this still problematic? And what percentage of people have problems with night glare?
Yeah, that's a great question. It's something we used to talk about a lot. I think depth perception really is not an issue. There was a time when we thought maybe if you used a microscope that you may find it difficult after laser. I think the reality is that's not true. I use a microscope every day, and I'm only a trial of one. But I have treated other doctors who use microscopes, and no one's had problems. The thing about glare and halos, that used to be a really big issue quite some time ago. We used to talk about glare and halos all the time. And that's partly because the way that we treated the cornea, we used to treat a much smaller area. And if you were someone who had a big pupil, at night time when the pupil got bigger, you might experience some halos and glare. Now, what we do now is we treat a much larger area of the cornea, Plus we have what we call a blend zone, which is instead of the laser treatment just stopping, it actually gets blended into the rest of the cornea. And that does two things. One is it reduces the incidence of halos and glare. And the second thing it does is it reduces the chances of regression. Now, do people still get halos and glare? Yeah, if you're somebody with a really big pupil, it is possible that you get some halos and glare. We do see that occasionally. I would say to you that with modern laser, it's in the order of, you know, ongoing halos and glares less than 1%.
Very unusual, yeah.
Pretty unusual. In higher, or you know, if you're -7, -8, I think most people experience some halos and glare in the first, you know, 1 to 2 months, but it doesn't seem to be an issue for people, and it gets better over time. So we used to talk all the time about halos and glare. We almost never talk about it now, and the reason being is there's been, you know, an advancement of the technology and a better understanding of, you know, the ablation that we create with the laser.
Great. Adam, we've had Bill come through with a question saying, how soon afterwards can you drive?
Well, if you're having LASIK or SMILE, then the vast majority of cases, probably the day after your procedure. Typically we would advise people when they're coming back for their first day checkup to have someone drive them, but honestly, in a lot of cases, people would be able to remove the shield from their eyes and just check that they're comfortable with their vision, and chances are they'd be okay to drive on in because their eyes would be comfortable, their vision would be good. So LASIK or SMILE, I would suggest that within a day or two, I would expect you to be fine, Bill.
Great. And then Nick, we've had a question from Bella. What are the potential risks? Do you know the average rate of infection for Eye Institute following the procedures discussed?
Bella, you ask a lot of questions.
The hard-hitting questions.
Yeah. Hey, look, you know, with any operation, there are risks associated with it. And one of the things we think about with all these procedures, infection, and in particular, not just infection, but also excessive inflammation. And we do see that from time to time. We're doing in the order of about 2,000 of these a year, and we'd probably see 1 or 2 infections. We'd be lucky to see one a year, so it's sort of about 1 in 2,000. Now, if you put that in perspective, if you were a contact lens wearer, the risk of infection, having an permanent effect on your vision, is around about 1 in 2,000. I think the important thing to be aware of around infection and inflammation is that if you do get that, it's very treatable, and it needs more visits with us, more drops, and maybe a slowing of the recovery period. But I would say to you that all the people that I've seen with an infection have ended up with excellent vision. Now, one of the problems is if you get an infection and you live in the jungle, or you live a long way away from appropriate medical help, then that can be a real problem, because, you know, if an infection isn't well treated, it can potentially damage your vision. Now, we just don't see that in the sort of environment that we're operating in.
Great. I'm going to hopefully wrap up with a few more questions. We've had one more come through, but I'll just ask the one that I've received. So post-surgery, when can I start wearing makeup again?
So not long afterwards, frankly. I mean, we often, you know, by way of a guideline, tend to say wait for about a week, but in reality, with careful application and careful removal, I think most of us would be happy for you to wear makeup within a few days of a LASIK or a SMILE procedure. I guess a lot of the concern would be that if you're being very vigorous, if you're removing makeup, you want to avoid that and want to avoid getting a lot of fluid in your eyes within just a few days of LASIK. But if you're careful, really not long afterwards.
Great. And then, okay, so we'll do the 2 more that have come through in the last minute. So Nick, can you tell us a little bit more about ICL? So we've got a question come through there, a few extra things asking about risks.
Yeah, I saw that. So it was a bit more than that. It was ICL and then the risk of cataract and endothelial cell loss. And for most people, they probably don't know what endothelial cell is, but essentially an ICL is an intraoperative procedure. Now, it's quite an amazing lens. It's biocompatible, it's very flexible, very strong, and it's inserted behind the iris, so the colored part of the eye, but in front of the natural lens. Now, of course, this is an operation inside your eye. And when we operate inside your eye, the thing that we really are most worried about is infection. Now, if you get infection inside your eye, fortunately, incredibly rare, 1 in 10,000 cases if it's a cataract patient. So if an ICL patient, it's probably less than that. But if you get an infection, usually we can treat it, but some people, even with treatment, will lose vision. So that's probably the first thing to think about with ICL. And for that reason, if you're suitable for laser, then we probably wouldn't consider ICL. ICL is for people who are not suitable for laser. The other thing about an ICL is that we know that if we use an ICL, then you're likely to develop a cataract at a younger age than you would do normally. Now, most of these people are very short-sighted. So people who are very short-sighted tend to develop cataract in their late 50s, early 60s, rather than mid to late 60s as compared to other people. So what we find is what I tell patients is that you're likely to, if you have an ICL, you're likely to develop cataract earlier than you would do otherwise, probably in your mid to late 50s. And if that happens, then that's not a big deal because you've already lost the focusing ability of your eye, and it's an appropriate time to have cataract surgery. And now we have lenses that give you both distance and near. It's a bigger issue if it happens under the age of 50. Now, the risk of that happening is around, with a modern lens, is around about 1%. Now, the interesting thing is it's 1% of getting cataract. Not all of those people need to do anything about that. A lot of those are subclinical, and so we see them, but the patient doesn't. Endothelial cell loss, well, the endothelium is the back surface of the window of the eye, and the reality is you have a certain number of cells. It's really important that you have the right number because it keeps the cornea nice and clear. But the reality is that for all of us, from the moment we're in our early 20s, the number of endothelial cells we have is declining. Now, if you have an operation, we know that that creates some damage to the endothelial cells, whether it's cataract surgery, ICL, so forth. Now, of course, this is being very closely looked at. And the interesting thing is, again, with modern ICL surgery, providing you stick to the parameters that the guidelines that are provided by the company that supplies the ICL, then the endothelial cell loss is minimal. And in fact, the evidence now is that, yes, you do get a little bit, but it's not enough to cause a problem for you in the future. So those are things, although we do check endothelial cell counts at the beginning, and we used to check those on a regular basis, we're less interested in that now because the evidence is so strong that that's less of an issue. I think the other thing to be aware of with an ICL is that not only do you have to get the power of the lens right, matching your glasses, for example, but you need to get the size right. We're good at sizing them, but in about 1% of people, it's not going to be the right size, either a little bit too big or a little bit too small. And in those people, we have to remove that and replace it with a different size ICL. So these are little differences between laser and ICL. ICL is still a great procedure, but if you're suitable for laser, laser is the right option for you.
So Adam, we'll end with one last question from Bill. Post-op, do you need routine ocular lubricants or any other drops?
Yeah, well, other drops, we do use medicated drops typically for at least a week afterwards just to help settle any post-operative inflammation. Lubricants, I think it's wise to expect to need to use them for a while. But in reality, for LASIK patients, I usually tell people there's about a 30% likelihood you're going to need some lubricating drops for maybe 2 or 3 months to treat a little dryness. So about a 70% likelihood you won't really. And about half that the evidence suggests for SMILE. So about 10 to 20% of people are going to need to use a few drops for perhaps a month or 6 weeks or thereabouts. We provide some drops to get you started. And usually it's really not that much of an issue for the great majority of people.
Yeah, like, I mean, basically, if you have an operation on your eye's going to feel a bit drier afterwards. And the interesting thing, for example, we do cataract operations where we make a tiny incision in the cornea, and even those people get drier afterwards. So as Adam was saying, after LASIK, for us, we kind of insist that you use lubricating drops for 1 to 2 months on a regular basis. But we find a lot of people who come in who haven't been using them, who haven't been bothered by it. But I think it's, you can expect to need to use some lubricating drops, particularly in the first 2 months. And in probably about 10 to 15% of patients who have LASIK, it would be longer than 2 months, but it always gets better. We're definitely seeing less issues with dry eye, and it's very unusual beyond 2 months for smile patients to need lubricating drops.
Awesome. So that's all of the questions. There's potentially a few that we didn't get to, but we will email those people directly. But over to you guys to wrap it up.
Yeah, look, I might start, Adam. I'm going to jump right in there.
No, not me.
Look, there's a very rapid fire session around laser, and it's probably answered some of your questions, but not all of them. Look, if you want to get a bit more information or you want to know if you're suitable, then you can book a free assessment with the guys here at Eye Institute. And if you give us a ring, we'll follow that up and arrange that for you. If you just want to have a bit more of a chat with somebody who knows a lot about laser, we also have the ability to do virtual consults with one of our technicians, and they can give you, more direct discussion. Can't decide for you whether you're going to be suitable for what procedure, but they can certainly answer a lot more of the questions. So that's available also if you wanted to pursue that.
And just to say really that it's been a pleasure talking to you all, and really appreciate you coming along and asking questions of us, plumbing our knowledge, and I hope it's been helpful for you. And thanks for visiting us tonight at Eye Institute.
Nice seeing you.
Cheers. And thank you, Jess.
Yeah, thanks.
Thanks, guys.
Okay.
Thanks,
Right, bye.